What are you doing? So this is, I'm really just doing a little push-pull. I don't know, her head's kind of out of the evaluation. I'm just feeling through the trunk of her body, really, to see how things feel. And I would say that when I feel her trunk, she has a tendency to rotate clockwise, viewed from above, and toward her right shoulder. There's your mom. She's right there. And your head's a little wobbly, but you're going to get stronger. And I'm actually doing the thing I said I wouldn't do today, or I didn't do very much of, which is I'm encouraging movement in the direction of ease. I'm encouraging more clockwise rotation. I'm following and moving through in that way.
Oh, that was
How'd
helpful.
that feel? Cool.
Normally that would have been. That's good. Keep it down.
That's pretty good. Yeah. I'm kind of following her movements. I'm leaning back just because I can tell that you are.
She just discovered her hand a couple of days ago.
So you're really precocious in that way. And I presume she's been social smiling up a storm for a while.
But she still kind of hits herself in the face and then will cry. She's trying to find in.
That makes Dad
Got stuck in a baby body, didn't you? I'm curious about lots of things, but what she really wants to do is, with some support, kind of lean back.
So it looks like you're doing Pilates.
I am, yeah. I'm pretty strong, so I could hold this a long time, which is handy in this moment. But at some point.
And you have one hand on the side of her head?
I'm kind of connecting in with her occiput. I'm using it as a handle to evaluate the mobility of her neck. Does that make sense? Yeah. Reposition you because I'm less comfortable. You ready? You ready? I'm going to have some practice time soon of moving your legs. Milk. It's all gone. Long time ago. So far.
He's so big.
Come back up. Good. Just supporting you, Snow, so that you can do whatever you want to do here. Will that work? Okay. Okay with that. You're gonna spit up on my leg.
All the time. Is she?
No. She might not feed your knee, but.
Yeah.
She's loving that.
I think she has pretty balanced length and strength in her neck. Yeah. I'm excited about that. Yeah. I'm still going to give you some stuff to do, and I mean, she does feel a little tight on that left side, but she does have good mobility. She can turn to the right.
Okay.
She has fairly good range of motion to the right. We can I mean, I could turn her and calculate how many degrees of rotation she has, but I think it's really pretty darn good. Yeah, and it'll get better. She does have a lovely stork bite. She's got a little bit down here, all the way down here too. It's all the same thing. She's just got a really fairly beautiful array of stork bites. Sometimes babies get them on their, between their eyes or on their foreheads.
She she has something on, she did have one on her nose.
Yeah.
Is that the same?
Yeah, they fade over time. So look at how far she's turning, and she's really, I'm just following her. She's doing really, really well for a baby who hasn't had tummy time.
She's had, I mean, just a ton. I guess she's had
on you.
Tummy time in different ways. Yeah. She hasn't just been flat down on the floor.
Look at that rotation she's doing. That's really, that's awesome. Look at that. Yeah. No problem here. In there.
Hi, Snow.
It's funny, for a long time, professionals that we were seeing just because she was a preemie, they would straight away know that she was breech without me saying anything. I always wondered why, and it must have just been also with the head shape, or...
It's probably the way she held her legs. That would, for me, that would be the big giveaway. Yeah, I think that she may have. It'll be interesting to see what happens when she starts to crawl. It probably won't be an issue for her, but some breech babies who don't have the hip dysplasia issues maintain that habitus of the jackknife for a longer period of time, and so the idea of getting their legs behind them is really tricky for them. I'm going to pick you up. You okay? Okay.
I'm sorry to be dribbling on your pants.
Look at that drool. Baby drool.
Yeah. We're going to get wiped. Stand back.
She'll wipe you.
Drip. Now she's going the other way. Now I feel like she's got a nice little rotation of her trunk.
She's going this
headed to her left now, and that's awesome. That feels really nice now. Her body had a little torque, and it feels really good now. Looking at you. I'm just talking. Yeah. I know I've been letting you flop around. Let's see what else we have here. Yeah.
With those cheeks.
Good girl. You came early. What's up with that?
Are you still doing direction of ease? No.
Basically, testing for and finding barriers in movement with her cranial bones. Mostly I'm working on the vault. I want to head into the cranial base and feel what's happening there. It's just put your friend on your hand. It's not exactly what you had in mind. Way up. Way up. Oh, you okay with her?
Oh, yeah.